Hi, I am Dr. Dilip Kumar, consultant endovascular and neurointerventional radiologist, Aster MIMS, Kannur. Today I am going to talk about stroke. There are two different kinds of stroke. One is ischemic stroke and one is hemorrhagic stroke. Ischemic stroke is the most common kind of stroke that affects the population. Ischemic stroke is common that affects the people. Ischemic stroke happens when a blood supply to the brain is cut off and there is no supply of oxygen to the brain, leading to brain damage. Hemorrhagic stroke happens mainly because of the bleeding in a brain, mainly because of the hypertension or brain aneurysms, rupture. Whenever there is ischemic stroke and the blood supply is cut off to the brain, every minute we are losing 20 lakh brain cells. So whenever a patient has a stroke, we have to get the patient at the earliest to the stroke ready hospital, and we have to improve the blood supply to the brain so that we can reduce the damage that is happening to the brain every minute. If we don't treat the stroke patients, there is a chance they'll be having complete and permanent paralysis for life, or sometimes they can lose their life also. How do we recognize stroke? There is an acronym called as FAST. F for face. Face can be deviated to one side. A for arm. There can be weakness of one side of a arm or the leg. S for slurring of speech. Patients will not be able to talk properly and the speech will be abnormal. And T is a time to reach the hospital. You have to reach the hospital at the earliest whenever you get to know the patient is having a stroke. Who are at risk for developing a stroke? People who are diabetics, who are hypertensives, who have heart problems, who are obese patients, and patients who are smokers are at a high risk of developing stroke. When the patient reaches the hospital, first we see the patient in the emergency room and we do a CT scan and a CT angiogram for the brain to analyze how much of a brain tissue is damaged. And we also know where there is a block in the brain blood vessel. The block can be in a major blood vessel, that is a large blood vessels of the brain, or the blocks can be in a small blood vessels of the brain. When the patient reaches hospital within 4.5 hours after the CT scan, we can give a treatment called as IV thrombolysis. This will try to dissolve the clots which is present in a small blood vessels of the brain. For larger blood vessels of the brain, IV thrombolysis works, but the chance of working is around 30%. When the large blood vessels to the brain is blocked, we have a most advanced treatment which is done without surgery, which is a pinhole treatment, which is called as mechanical thrombectomy. In mechanical thrombectomy, we do a small pinhole in the region of the groin and we reach the blood vessel in the brain with the special tubes and stents, and we try to remove the clot with these materials. Mechanical thrombectomy is highly efficient in removing the clot from the large blood vessels of the brain. Once we remove the clot out, the blood supply to the brain immediately starts and we can reduce the damage to the brain that is happened with the stroke. And patient recovery chances are very much higher and faster after the mechanical thrombectomy. Mechanical thrombectomy can be done up to 6 hours if the patient reaches to us at the earliest. But depending on CT scan findings, we can also give the option of mechanical thrombectomy for a patient up to 24 hours of stroke onset. Mechanical thrombectomy was started around approximately 10 years ago, and in 2015, American Stroke Association has recommended and added it in a guidelines as a first-line treatment for a large vessel block in a brain. Brain is the most precious organ of the human body. As brain cells do not have a regenerating capacity, once they are damaged, it's a permanent loss to the patient. When we have such advanced treatments for treating stroke patients, we urge the patient to reach the stroke ready hospital at the earliest so that we can give a better functional outcome and good clinical outcome to the patients who are suffering stroke. With the help of IV thrombolysis and mechanical thrombectomy, which are the most advanced treatments for stroke patients, we can improve the blood supply to the brain and help the patient to recover faster from the stroke.